So I work on multiple myeloma, which is basically a disease of the plasma cells. There was an antibody that got breakthrough status in 2015. Its name is Daratumumab and the epitope is CD38. So it got breakthrough status because it basically improved results so much. Patients' PFS was increasing by easily 6-8 months. However, since its launch in 2015, nearly everyone has been getting it, and patients have now become resistant to that antibody. So, and we found out that the reason for the resistance is that the plasma cells lose the expression of the antigen, which is CD38. So, the rationale behind my study was how can we resensitize patients, and to do that what we can do is increase the expression of the antigen again, and hence the antibody will work again. So in general, DNA methylation deregulates or decreases the expression of a wide number of genes, and I found that there was a CpG island on the CD38 promoter, and I hypothesized that DNA methylation could be regulating CD38 expression. So then my study is basically about the testing different DNA methyltransferase inhibitors and whether they can increase the expression of the antigen. And I tested those in cell lines and in ex vivo patient samples from bone marrow biopsies, and it actually worked. So that's in brief the description of my study. Actually, the paper just got accepted into leukemia, so there has been enough for one paper. Definitely, so we tested it in multiple cell lines, we tested it in ex vivo patient samples. I also tested it in functional assays, showing that actually, so there's the method by which an antibody works is antibody-dependent cell cytotoxicity, so there's an assay for it. And so I treated the plasma cells or multiple myeloma cell lines with the DNA methyltransferase inhibitor, and that increased the expression. And then I put these cells with increased expression into the ADCC assay, and in that functional assay too, we showed that there is increased expression and increased lysis of the plasma cells that had been treated with DNA methyltransferase inhibitors. And this is very clinically valid because the DNA methyltransferase inhibitors have been in the clinic forever. They are actually approved for MDS, for myelodysplastic syndromes, and for AML. They are not approved for multiple myeloma. So they're already FDA approved for one indication, and Daratumumab is approved for multiple myeloma. So it's pretty easy to combine these and do a clinical study. And actually at UCSF they're trying to start a clinical trial based on this. So I'm not sure, after we figure out funding and everything, we should be starting that.